why the main indication for this formulation is metabolic syndrome, diabetes type 1, diabetes type 2, even gestational diabetes. We're seeing patients with gestational diabetes who respond within a week, to these peptides. And the protocol of treatment, usually we do it as a consequence after the stem cell treatment. It's only 2 or 3 vials intramuscular per week, and duration matters. We're talking at least 10 to 15 weeks. 10 to 15 weeks. And this protocol can be repeated twice a year. What do we see as an outcome? Basically, we see the reduction of the insulin resistance. Mostly what I see is the reduction of the serum insulin level. So it has more like a normal spikes and troughs, sort of a pattern, and improvement of the glucose and the lipid metabolism. The mitochondrial peptides, which are naturally occurring in the cardiac myocytes, again, thanks to the research which is done in Japan, and for the past less than 10 years, 5-6 years, and they've established that the major factor that will predict survival of the patients with cardiomyopathy is the level of the protein aggregation. In other words, it's how bad the autophagy in the cardiac myocyte is impaired and how much of a junk protein, cross-linked protein, is accumulated within the cardiac myocyte. That will determine whether the patient going to survive within 5 years or is gonna die. Because impaired protein quality control leads to misfolded protein aggregates, cellular death, damaged mitochondria is like a vicious cycle, cardiac hypertrophy and cardiac tissue remodeling. It turns out that mitochondrial peptides naturally occurring in the naive cardiomyocytes, they involve in activation of the autophagy and antioxidative stress protection. They also stimulate mitochondrial biogenesis, and they significantly express glycolytic related to the glycolytic process and oxidative activity. We use them in all forms of cardiomyopathy, patients with ischemic heart disease, as well as the pre- and post-operative care for the patients who go in, even for the open heart surgery. We combine them actively with the coenzyme Q10, high-dose co-carboxylase, meldonium, hexarelin, stem cell therapy, AASCP, HBOT, and so on and so forth. And as an outcome, we see very rapid increase of the ejection fraction and overall cardiac function. Clinically, phenotypically, it's a disappearance of cyanosis. It's a much better physical activity in patients, reduction of shortness of breath, peripheral edema, and so on and so forth.